And then within some minutes, that girl died. It was a sad sight to see, whereby it was the only daughter for that family.
Mercredi fièvre, jeudi fièvre, vendredi, elle décède. D'une maladie qu'on ne connaissait pas.
Eu acabei perdendo a minha mãe por conta desta doença, malária.
Recognizing the weight of the malaria burden on the African continent, the African Union Heads of State and Government, under the banner of the African Leaders Malaria Alliance ALMA, have come together to work towards eliminating malaria in Africa by 2030. On assuming the chairmanship of ALMA for the period 2020 to 2022, His Excellency President Uhuru Kenyatta set his agenda outlining 4 key results-based priority areas. These include digitalization by expanding sharing and use of malaria and health data through regional and country scorecard tools, establishing end malaria councils and funds to boost multi-sectoral action, advocacy, resource mobilization and accountability, increasing coordination and engagement on malaria through Africa's regional economic communities, and the creation of an army of malaria youth advocates to champion political and resource commitments.
Countries are launching national malaria youth armies to mobilize a new generation of leaders to champion the fight against malaria. Our regional economic communities continue to keep malaria high on their agenda. Countries are enhancing cross-border collaboration and coordination. The regional economic communities have mainstreamed the agenda for the war against malaria, including at head of state, ministerial, and technical level. The second of the 4-point agenda was the multi-sectoral advocacy, action, and resource mobilization. It is notable that to date, 23 African countries have launched the national Zero Malaria Starts With Me campaigns. End malaria councils have also supported national malaria programs to implement key activities.
To successfully eliminate malaria by the end of this decade, commitment from all sectors and citizens across the continent is essential. Governments, the private sector, civil society, and communities all have important roles to play. In appreciation of this, countries across the continent are establishing national and malaria councils and funds to mobilize multi-sectoral advocacy, action, resources, and accountability for the fight against malaria. These councils and funds convene senior leaders to work together to help countries overcome operational barriers and resource gaps in national malaria strategic plans. They are also valuable champions for the Zero Malaria Starts With Me campaign.
We've been doing a lot of work around promotion of spraying, for example, and making sure that people are aware. You have billboards across the country. We've sponsored radio acts. But in everything that we have done as the End Malaria Fund, we've been working with the program. It's very important to understand that our role is to support the government established national malaria program, and our work is to fund the activities of the national malaria program. We go to corporates, we ask for donations in kind or donations that are actual cash, and what we then use the money for is we use it for activities that the national malaria program tells us are necessary.
Normalmente os países africanos têm por hábito receberem apoios de fora. E esta foi uma das lutas que nós travamos para mostrar às pessoas que sim, a malária começa contigo, mas também o apoio começa contigo, comigo, com o empresário, com o político, com a sociedade civil, e nós fomos passando esta mensagem.
In Zambia, the End Malaria Council has led a 2-year communications campaign to raise and sustain visibility on the risks of malaria during the COVID-19 pandemic. The council has also supported the transportation of insecticides to rural regions, donated trucks and vehicles to the National Malaria Elimination Center, and raised funds to support community health workers implementing mass drug administration in targeted, high-burden districts. Complementing this work is a coalition of faith-based leaders drawn from Christian, Baha'i faith and the Muslim community in Zambia. The coalition, known as the Faith Leaders Advocacy for Malaria Elimination, or FLAME, helps amplify this work at the community level.
The main issue for us as a church and as a community is to advocate on how to prevent ourselves from getting malaria.
We all gather in one place and the message goes to different people coming from different places, so they'll be able to take that information out there and tell people about the prevention and what to do when people get to have symptoms and signs of malaria.
Malaria is not a problem, it's not an unavoidable problem. We can avoid it and we can cure it also. So we have the challenge of mobilizing and explaining to the people how to avoid malaria, and if someone is infected of malaria, how to cure it, how to go to the hospital, to the clinic and all these things, because malaria is not only a matter of health, but it's a matter also that is affecting the economy of the country also.
Within the context of multi-sectoral advocacy, action and resource mobilization, traditional and community leaders have also been brought on board to support the implementation of the National Malaria Strategic Plans.
My involvement at the grassroots is to ensure, to provide feedback information as to what is a gap in this fight against malaria. So where we've noticed that, for instance, there are no mosquito nets and so on and so forth, or no drugs, that's where we come in to ensure that we feed into the system up to the national level. So the synergy is working out well for us, using the various partners and the non-government organizations.
As End Malaria councils and funds continue to expand across the continent, a new coalition of African leaders will be empowered and equipped to combat malaria. To date, 15 countries have established or are in the process of establishing End Malaria councils and funds. Working together, they will ensure that malaria remains high on national development agenda, that national malaria programs have the resources needed to implement the national strategic plan, and that all sectors take responsibility for achieving the goal of eliminating malaria by 2030.
We are absolutely also proud and also very humbled to be African, seeing the vision that has come from President Kenyatta, which is moving forward with that and developing a youth army. We love it because a lot of the population of Eswatini, in fact, something like 70%, are younger than 35 years old. This is the future.
We do want to encourage families to talk about it, to react very promptly by taking their children or themselves to the test centers, get tested, get the malaria treatment as soon as possible.
Us as the youth group, we organize ourselves to sensitize people on malaria, on how they can eliminate malaria through poems, drama performances, and songs on malaria. We just started last year, so by means we're trying to push so that we could engage more people.
In February 2021, His Excellency launched the ALMA Youth Strategy. This has seen the recruitment of 3,000 Malaria Youth Army champions from 38 African countries who now work with existing youth leaders across the African continent to champion community engagement and resource commitments for malaria elimination. Under the leadership of President Kenyatta, ALMA has also established an ALMA Youth Advisory Council who provide strategic guidance on implementation plans for national-level malaria youth armies. To build their capacity, this trailblazing cadre of malaria youth champions has been trained on malaria, advocacy and leadership, as well as the use of scorecards to drive action on malaria elimination. As well as intensive engagement at county level, ALMA is also working to support action across countries. Regional economic communities are enhancing regional coordination in the fight against malaria. This has resulted into enhanced cross-border collaboration and coordination.
Malaria on the African continent has killed more people than COVID has, despite COVID being a global pandemic. And this is why we have been focusing ourselves to see how it is that we can work to not only eliminate malaria, but to also ensure that it is a community-based and a community-led program, that the solution to this battle does not lie with foreigners, but lies with ourselves. The most important fact to remember is that the mosquito, unlike us, does not require a passport. So irregardless of what efforts an individual country does, unless we do it together, we will not succeed in this battle.
As you know, the ALMA goal is to end malaria by 2030. And in this end, we like to see the various countries in Africa working together, and we do that regionally. So I focus on 3 regions: East African Community, Central Africa, that's ECAS, and the IGAD region. And together we work with the AU to deliver on the agenda of ALMA.
Today, malaria is being mainstreamed throughout the agenda of regional economic communities, including at heads of state, ministerial and technical levels. For example, the Southern African Development Community, SADC, heads of state and government signed the WINDEC Declaration on eliminating malaria in the SADC region. The SADC Ministers of Health also approved the operationalization plan for the WINDEC Declaration on malaria elimination in the region. The Economic Community of West African States, ECOWAS, has mobilized resources to support malaria coordination through the West African Health Organization WAHO Secretariat. The East African Community, through its Great Lakes Malaria Initiative, has launched strategic cross-border approaches aimed at eliminating malaria within the region. States in Central Africa have acted too, with the Economic Community of Central African States, ECAS, developing its regional malaria strategic plan, while the Intergovernmental Authority on Development, IGAD, embarks on identifying regional malaria priorities. Africa eagerly awaits the dawn of a new future, one without malaria. But until then, the fight against malaria must be approached from multiple fronts with strong action at the community level. At this level, engagement remains essential to improving health outcomes, especially by allowing citizens to become more active participants in strengthening health systems. By adopting the use of community scorecards, member states have made progress towards equipping communities to identify and address gaps in the health system.
Initially, we train the health workers. For instance, we have a health center. We train the health workers here together with the community on the community scorecard. Then later on, we specifically identify the community committee members. We don't nominate them. They are either nominated by the community leadership, for instance, the chief, supported by the assemblyman and other opinion leaders. So they select these people, we train them on the community scorecard. After the training, they do an assessment. The assessment is in two parts. The first assessment looks at the entire facility, what is available, the environment, the equipment, the human resource. All that is needed to make sure that service delivery can go on in the facility. The second part is the point of care experience. That is those people from the community who have had or who have accessed care from the facility. They interview them to assess their experience when they were in the facility. So they get this information together with the assessment of the facility, they analyze it and they present it to the community leadership. The community leadership now invites the health workers in the facility in that catchment area and then discuss the results with them. Of course, the results will come with recommendations. At that meeting, they agree which areas will be taken up that needs improvement, that can be done by the community, and which areas that improvement that can be done by the health system, that is the facility.
So we have groupings, the tailorers group, the market women group, the churches. So we have all those groupings around. So they pick people from the groupings together. They schedule a time, pick people from the groupings together, and then with permission from the health directorate and the facility where they will be doing the assessments, they come around and then assess the service delivery of the providers and then the facility itself, the utilization of the facility.
Here is Have Health Center. For the past, there is no light here. For the past, the road was not good. For the past, no water. So we sit down, then we have a discussion to see how to solve the problem. So through that, we are solving our problem. And at times too, we tell NGOs to help us in such a way. So they too, always when we call them, they appreciate us and help us. So things are moving all right.
For government, partners and decision makers, the community scorecard provides a regular feedback mechanism and key learnings based on communities' assessments of available health services. This enables planning and re-strategizing to address the citizens' greatest concerns and improved health service delivery.
It is working, and it is very, very, in fact, at the lowest level is where the service really occur. And if you look at our over 6,000 chiefs zones we have in this country, that covers the entire country. And so we are soliciting the input, and we have since been able to see, since the scorecard was introduced, we've been able to see improvement in services. We have also been able to see, most importantly, community contribution to service delivery in the very community that they. So there's a good buy-in, and it's working. And also keeping our people on their toes to ensure that they deliver us what the people need. Of course, making sure that it is what is appropriate and what is mandated for them as a service agency.
We can testify that yes, our involvement has really transformed or made changes, as I have already shared with you. And so it is a positive step that I believe that it should be implemented everywhere feasible, so that people can appreciate the essence of the community scorecard.
Scorecards track the quarterly performance of priority indicators from national strategic plans. Color-coded to signify varying progress, the digital tools make it easy for all stakeholders, from community members to health workers and politicians, to access and interpret the data, leading to real-time action. Scorecards have led to increased resource commitments from government and partners, mentoring and training of health workers, addressed commodity stockouts at health facilities, and helped to address upsurges and outbreaks. In February 2021, President Kenyatta launched the ALMA Scorecard Hub, a platform for countries to share scorecards and other best practices publicly. To date, 13 member states have published national scorecards via the ALMA Scorecard Hub, providing an opportunity for African countries to learn from each other. The hub also provides free resources such as online courses and technical assistance to support capacity building at subnational and community levels to enhance data-driven decision-making and accountability. The fight against malaria in Africa is one that requires collaboration and commitment, with every stakeholder playing their part. Through the continent-wide Zero Malaria Starts With Me campaign that was endorsed by the African Union Heads of State in 2018, individuals, families, communities, as well as political and business leaders in Africa continue to make a personal commitment to step up the fight against the disease. This commitment is evident among community champions powering the fight.
Salam alaikum. En 1999, dans la communauté en général, il y avait une maladie qu'on ne connaissait pas. Une maladie vraiment qui nous a fait perdre beaucoup de vies d'enfants et de femmes qui accouchaient, des femmes enceintes. En 1999, à 10 jours de la rentrée des classes, ma fille amie avait une forte fièvre. Elle était vraiment très fatiguée avec cette fièvre et on préparait la rentrée des classes. Avec cette fièvre, Ami avait des difficultés même de marcher. On allait visiter la médecine traditionnelle avec des racines, des feuilles. Le jeudi, Ami s'est apaisé. Il n'a plus, la fièvre a diminué. Mais le vendredi, je devais retourner à Dakar pour travailler, pour aller à mon lieu de travail. C'est un vendredi. À 14 h, je suis sorti pour aller prier à la rue Blanchot, à côté de la rue Carnot, où se trouvait l'UNICEF. Au retour, la standardiste m'a dit « Ah, votre sœur a appelé. Votre petite sœur a appelé. » Alors, j'ai appelé. Ma petite sœur m'a dit « Ah, il faut rendre grâce à Dieu, Ami est décédé. » Comme ça, je l'ai eu, comme ça, au téléphone. Mercredi, fièvre, jeudi, fièvre, vendredi, elle décède. D'une maladie qu'on ne connaissait pas. En tout cas, ce qui m'a motivé à venir lutter contre le paludisme, c'est parce que j'ai perdu une fille qui m'est très chère, 12 ans, 10 jours à 10 jours de la rentrée des classes. Mais aussi, ce n'est pas seulement elle, il y avait d'autres enfants. Et ça, c'est mes enfants.
waaw dëkk bi naa Kër Banda dañu doon bi ne sibur bi tar na fi torop nag yàlla boole noog àllaaj boobu mi mu tuddee comité bi muy liggéey sopp nabi yàlla boole noog moom mu dinu tegtal dinu tett naa def di leen bale di génn pënu yi taataa ndox yi nu di ko tere xale yi ba nu continuer bi nu continuer di dandal pënu yi pot yi nu di ko yi dax war a taaj ndox du nawetee ba xam ne yow bi dina fi ñëw nu fab pot yooyu du nu gasee ba mu xóot nu fab pot yi dugal ci biir bale ba mu set nettoyé ba mu set daal nu takk sànke nag moustiquaire moom du nu jàppale ci lu baax la ci sibbiru bi moom moustiquaire moom.
That girl was aged 4 years old from a certain village, and then it so happened that this child was just convulsing. There's nothing that I could have done at that particular time apart from giving the drugs that would help to resuscitate the girl child. Then thereafter, after some time, we tried to give, after testing for malaria, we found that it was malaria positive. And then within some minutes, that girl died. It was a sad sight to see, whereby it was the only daughter for that family. And then for me, just to cover the corpse, I couldn't just bear it to say, okay, the girl has died, because the girl still looked very healthy, and I wished that girl, even up to now, can still live so that we can still see her around. But then after some time, I just had to cover the girl, and then they had to pick the body, taking the baby at home, the girl home, as per tradition. Then, so from that time, it really clicked to my mind that what can we do for us to prevent the malaria or people dying from malaria as at a tender age?
O que me fez ou que me faz estar assim muito ligada ao combate contra a malária é exatamente o facto de eu ter perdido alguém muito, mas muito especial para mim, que foi a minha mãe. E eu acabei perdendo a minha mãe por conta desta doença, malária. Olá! Tudo bem? Estamos tudo bem? Pode, por favor, aproximar. Para além de ser cantora, eu tenho muita influência nas redes sociais e, graças a Deus, muitos seguidores nas redes sociais. E é por isso que eu tenho também trabalhado a partir das minhas redes sociais, o meu Instagram, o meu Facebook, para sensibilizar as pessoas do uso da rede mosquiteira, da existência da malária, que a malária realmente pode matar. Juntos podemos combater a malária.
Central to the success of the Zero Malaria Starts With Me campaign is the strong network of partners supporting national elimination efforts through various interventions.
Et donc, il nous a valu quand même de réduire considérablement le nombre de cas de palu, mais également les décès liés au paludisme. Comme en attestent les résultats de notre plan stratégique que nous venons d'évaluer 2015-2020, où on a constaté une réduction des cas de palu de plus de 10% et de la mortalité de plus de 25%. Le paludisme est prenable parce qu'il y a des pays qui sont parvenus à éliminer le paludisme, et pour moi il est inadmissible que des gens meurent encore du paludisme au XXIe siècle.
Quand on parle de santé publique, les décisions politiques peuvent être prises, mais si nous n'avons pas un engagement communautaire à la base, on ne peut pas avoir réellement la réalisation de nos objectifs. Speak Up Africa a réellement travaillé avec le maillon communautaire pour mettre en place et favoriser une appropriation communautaire à travers des champions communautaires, une initiative qui a été lancée avec Wari et qui a fait qu'aujourd'hui, en presque 3 ans, 8 champions ont eu à mener des actions directement qui ont ciblé les communautés en les sensibilisant, mais aussi en permettant, à travers des visites à domicile.
To date, 23 countries have launched the Zero Malaria Starts With Me campaign, with more at the cusp of joining. The movement is one that every member state needs to commit to steer Africa towards a malaria-free generation.
Zéro palu, je m'engage. Zéro palu, engageons-nous.
Zero malaria starts with me.
Zero malaria starts with me.
Malaria zero
starts with me.
Começa comigo.
Every year, malaria claims hundreds of thousands of lives, taking away from our social fabric and chipping away at national economic gains. Yet, this disease is preventable and treatable. By stepping up the fight and continuously reinvigorating our efforts against malaria, the goal of achieving a malaria-free Africa and a thriving continent as envisioned under the banner of Africa's Development Blueprint, the Africa We Want, Agenda 2063 is within reach.
A very good foundation has been laid as a path to elimination of malaria. Malaria can be defeated. Malaria will be conquered on the African continent. We must believe here in Africa that we have the expertise and we have the tools that can actually defeat malaria. Other countries have done it, we are going to do it. But we must resolve that we must coordinate our efforts, because Africa is a huge island. It is easy to eliminate malaria in small islands, but because of the vastness of the African continent, then this coordination under the African Union leadership is very key for us to attain the goal of malaria elimination from this continent by 2030.
Zero malaria starts with me. Zero malaria
starts with you. Let us work together to ensure that we eradicate malaria from our African continent.